I mean,
Jeez,
I don't know
remarkable
what
guy.
more I would need
Was.
for it, you know. So it's pretty slick.
Are you going?
There's an outlet right there.
There is.
I thought about it, but
It's pretty snazzy.
Hand it up.
I don't know, you never know. That's a few
Hopefully it
days
was
away. Things
peaceful in your street rather than.
the driver, you're more accustomed to driving than I
That's
am.
right.
don't bother me.
Adjust my grip and get the cap.
Oh, when I was young, I
Okay,
didn't mind it.
got it this time.
But at my age, it's not as comfortable.
Now, is this your one charger?
Yeah.
What's the age got?
Well then,
Yeah.
So don't tie any knots.
so I'm not going to tie a knot, but I'm going to loop it for you.
Oh, thank you.
Oh, the energy I used to just love to go to the lake and go snow.
It'll slow it down.
Calm down, calm down.
Had.
See, I've got a.
Ice and-
I've been here long enough. I asked him for a spare to leave.
And then I loaned out my snowmobile to Frank
I
Rebo
thought
and
of
smashed
that,
it
and I
up.
think I might go that route.
Hopefully
It may be
gonna have
worth
that
Did you hear
taken
about that?
repaired.
You could do that truthfully.
Poor guy.
We could
Glad
share
he-
one because mine
got
is
a little
often.
hurt,
They're
too.
not often discharged at the same time.
Oh, okay.
And I don't need mine plugged in. I plug it
Brand
in
new
as
snowmobile.
habit. Sometimes I should probably let the battery run down a little bit.
One more reason why I don't ride a snowmobile.
I gave mine away. I really don't
I
care.
have one to get in and out of mine.
We arranged that ahead of time.
Well, yeah, and it would work. It would
I talk about that all the time. They all usually wear blue.
Scrambling.
The only problem is sometimes I kick it and I pull the plug out of the transformer. It can stay plugged in. I always wear those.
Yep. He always wears
Are we
blue.
on go?
Yeah, the camera's on.
Okay.
For some reason, Myron bought a pair of pants that match his chair. He doesn't have them on today, but
Oh, I have. Oh, that's right.
You have.
I do have a pair of maroon pants.
Hi, Jeff.
That was the colors for Anoka.
That conversation
Morning,
was
Jay.
telling us in trouble if the camera was on, so I'm sorry I brought it up, but I'm glad the camera was on.
I think the
The
camera,
camera is on.
Color coordination.
It just proves that when we're not on camera, we're talking about clothes and shoes and not anything else that we shouldn't be. All right, if everyone's ready, we will call the Public Health and Human Services Board to order on January 15th at 8:30 a.m. And we will start with the approval of the consent agenda. Is there anything anyone would like to pull? Okay, can I get a motion to approve?
So move.
Second?
Any discussion? All in favor?
Aye.
Any opposed? All right. Next item of action we will move into is the election of the board chair and the vice chair. If anyone recalls, yes, we did forget to appoint a vice chair for the last 2 years, but we're back on track for this year. And so just a reminder of how board elections go. It is by nomination. So I will ask for nominations. Nominations do not have a second. So I will ask 3 times for a nomination of a member, and then we will vote. Is there anyone who is unwilling or unable to fill the position of chair for 2019? Bobby, Myron, and Dave, and Carla, and Jerry. Okay. So please do not nominate those people. All right. So for the 2019 board chair, can I please get a nomination? Ginny,
I will nominate Heidi.
for board chair.
Yes.
Are there any other nominations? Any other nominations? Any other nominations? Okay. With 1 nomination for board chair, it's usually an automatic, but I will still take the vote. All of those in favor?
Aye.
Any opposed? All right, moving on to vice chair. Is there anyone who is unable or unwilling to fill the role of vice chair for 2019? Bobby? Dave? All right, so that leaves Carla, Jerry, Ginny, and Myron available for nominations.
Oh,
Are there-
take me off of it, too.
Take you off of the list. So that's Ginny, Jerry,
There's
and
many
Carla.
others.
All right, can I take nominations for vice chair, please?
I nominate Jenny.
Okay, any other nominations? Any other nominations? All right, being one again, all of those in favor for Ginny as vice chair?
Aye.
Any opposed? All right, excellent. So we have Commissioner Dukirk as chair, Commissioner Storley as vice chair. Thank you all for your support and your willingness to serve and to make the nominations and make this a smooth process. We will now go to introduction of new staff.
So excited to welcome and introduce, finally in the flesh, Grace Grenager, Cook County's new public health coordinator. Grace started part-time distance orientation in February and has November, thank you, February. And she's been here in person since the 31st of December. Okay. So Grace, if you want to just say a few words.
Sure.
I don't think your microphone works, but.
I don't know if the microphone works either. I can just speak loudly, I guess. I'm really happy to be here. I've just moved into the community with my family. Like Allison said, I was doing some remote orientation when Joni was still here, and she's given me some good backgrounds to start in my position. I've worked in the public health sector in different settings for over 5 years, probably about 6 years now, but this is my first time working in county government. So I'm excited for the new challenge and for getting to know the Cook County community, and I look forward to working with all of you as time goes on.
Any questions for Grace? Thank you and welcome. And just a little bit of factoid for the small town community. She moved on to my brother's road, Brandon Lane. So, very exciting when we get to find those things out in our first meeting together. So thank you and welcome. And next, we will move into the presentation. And with us today, we have Rita Pleward, Teresa Borak, Hartley Nuolacero, and Andrea. Which one of you is starting?
I'm going to start quickly. I just basically want to say thank you to all of you. You're beginning a new year, and I gratefully thank you for the work you do for the county. It is not an easy job, as you know, much better than I, but we are really grateful to be having to have had the experience and continue the experience of working with you. As you will see in the slideshow, that Hartley does since 1998 in a collaborative agreement. And I think working together over the years between Sawtooth Mountain Clinic and the Public Health and Human Service Department, we actually take this energy and the work that we do, and we have found over the many years that it leverages not only additional funding opportunities to continue to do what needs to be done, but also it leverages further collaborations that literally ripple out and bring more of us together to actually take time to be able to have enough people around to do the good work, to take the time to really better understand what our citizens and the people need relative to community health and how to integrate that into community policy and community awareness of the value of health. So I thank you very much. I have been incredibly enthused, probably over-optimistic at times with this relationship of county work and community health center work and the freedom that it brings to explore innovative and creative ideas within a community. So I thank you for being willing to work with a very small, private, independent, nonprofit, federally qualified community health center, because it really has expanded our opportunities also. So thank you very much. That's sort of my 2 cents, of course, because I just lead the force. I don't do the hard work on the ground out in the community per se. So I'm going to turn the actual presentation over to the people that really do the work out in the community. So thank you very much.
All right, thank you guys. It's a privilege to get to update you on what we've been doing this last year. So as Rita mentioned, this has been working for some time now, since '98, and these are the 5 components that we consider in this partnership: the county, the clinic, child and teen checkup, the WIC program, and then the statewide health improvement partnership. And that's we'll introduce Andrea a little bit later. before I get started slinging numbers at you though, I did want to set up some context. And health, this idea of health, it's a really broad concept, but often we think of it in these smaller individual factors, like who I am, who you are as an individual. Or perhaps we think about our individual behaviors. She has a healthy diet, he is a fit person. But it's actually even bigger than that. And this is where we begin to talk about what we consider the social determinants of health. These are things like the public services and infrastructure, the education that's available in a community, what kind of transportation is available, what kind of health care can people get. That impacts an individual and community's health. There's an even broader circle, and that's our living and working conditions. This is where things like access to food comes in. Maybe I want to have a healthy diet as an individual, but if I live in a food desert and it's not available, well, I can want it all day, and that's not going to have much impact. If I want to provide for my family and work hard, if there's not jobs, then that's not going to have much impact either. And the last ring of this are the social, economic, and political factors. This is things like segregation, racism, inequality, political participation. So while health is broad, sometimes we get a little narrow in our focus. I think this visual really helps me to remember that it's a much bigger picture than any one individual's desires or decisions. So here are our numbers for this year. In January through December of 2018, we had 469 direct contacts and over 34,000 contacts in an online format. And I'll tell you a little bit more later about what that looks like in particular. And that online contact is a significant increase from 2017. We're finding that works well to plug into people. Our blood pressure and blood sugar screenings, we saw 130 clients and did 163 screenings. Oftentimes people will come and they'll have two tests done. That's why there's a little discrepancy there. Saw 148 for foot care. Worked with 35 moms and babies in maternal child health and childbirth programming. We had 8 people come through the Living Well with Chronic Pain class. That doesn't always make, so we just have to run it at the flagpole and see if there's enough people, but then we'll always try it again, and this time. And there's also a Living Well with Chronic Conditions class, so sometimes they get offered in a rotating kind of way. We had 34 people come to our Caring for Our Whole Selves community filming event, so we were really pleased with that turnout. And then at the very end of 2018, Christine Kunze did a car seat live stream. We just thought, well, all right, let's just do this and see what happens. And we had 216 views and 188 minutes. It was really, it was interesting because I had people chatting over here, asking me questions that I could ask Christine that then she could answer so everyone could see. I was very pleased with the way that went.
She's currently our only certified car seat technician in the county, so she is the one who's responsible for assisting families to insert their car seat properly when they have a new baby. So that was a fun thing to do, to try to broaden that audience.
Yeah, and during the presentation, she and I were chatting, and she said she's worked in an emergency room setting. She's been an ER nurse, and she said, I would much rather make sure people are strapped in safely, work on this end, than have to take care of them on that end.
Well, if anyone watched the national news this morning, a baby in a car seat fell out of a car in Mankato because it was not properly secured. So it is important.
Hopefully, you've heard of our Hot Potatoes and Tater Tots program. the hot potatoes, the little subtitle is parenting help when things get hot. And so the hot potatoes are they're targeted at families that have tweens and teens. And then a few years ago, we started the tater tots, and that's for parents of the lowers, preschool, elementary age kids. The first one we offered last spring was called Navigating the Virtual Playground, and it was about online safety for kids. We had 6 attendees, but we do have an email list. And so 165 people got the synopsis afterwards. This fall, we did From Clutter to Calm. And there were 6 attendees, and again, the same number of email recipients. But we were able to live stream and then archive both of those workshops. And we've had 173 video views in 157 minutes. Mary Zabraki is our registered dietitian and enjoys teaching for us as well, in addition to working with folks one-on-one. And she did a class on the Skinny on Fat back in November. We had 15 attendees, and it's had 358 archived video views and 254 minutes viewed. So it's gotten a lot of watching too. Now we also have the traditional media with the topic of the month newsletters, which you've got there in your packet. And I gave you 3 topics of the month, just sort of for a sampler, and then I gave you the synopsis of both of the hot potatoes that were done, the calm and the negative nutrition. We've got 165 people on that email list, but we put them out at the clinic as well. So they're in every exam room, they're in the waiting room, they're available in the atrium. And we don't know how many people take them or read them, that kind of thing, but we do know that there's over 24,000 potential impacts. Then we posted on Boreal they have over 11,000 users per month. I go on the radio, and nobody really knows how many people listen to that, but Northern Wilds, Amy Marie Schmidt writes articles every month, and we know that they impact anywhere between 14,000 and 20,000 readers a month. I wrote 5 articles for the News Herald this last year around our programming, and so that comes out to be about 20,000 possible exposures. We're wading off into new media, too. We've been doing that for several years. Our clinic Facebook page has 557 followers, and our posts reached over 31,000 people last year. Over 3,000 video views and about 1,700 minutes of videos were viewed. The local food market also had a Facebook page that I took care of, and there was 96 followers on that one, and almost 2,000 people were reached through those posts. And then the Move It program last spring had a following of 35 people and reached over 1,200 people with their posts. So that's it on the media end. The WIC end.
So WIC is the Women, Infants, and Children. It's a federally funded nutrition education program that is for pregnant women, infants, and children up to 5 years old. This has been an ongoing collaborative effort since, again, 1998. Typically, WIC is administered through a public health entity in other counties in Minnesota, but you have given us the opportunity to administrate it through the clinic, and it's been a great partnership. We have approximately 115 to 120 participants, and we offer the WIC clinic on the 7 Tuesdays of the month. We flow over to Wednesdays, but we're very willing to accommodate people at those days not working. Amy Marie Schmidt also works in that, and then Karen Goldstrand is our clerk. I think one of the really pieces I'd like to highlight with this is because we're working through the clinic, and Karen is the clerk for the WIC program, and she also is the front desk staff. that she has this access and this connection to people. So when they come in for the well child check, she can see if they are due for a WIC visit or a recertification in that program. She just has this great ability to reconnect. And we can also use the data, the heights and weights that's collected at the clinic, and don't have to repeat it in the lower level at the WIC program. So it just really has a lot of advantages to under the clinic umbrella. So this one. I think I already said this. They get specific food vouchers with specific foods on it. The big thing that's going to happen in the spring is that instead of from paper vouchers, it's going to go on to a debit card, similar sort of like the SNAP program is. That'll be a big advantage for the participants. And we also have a peers breastfeeding support program underneath that WIC umbrella, and Christina Riddlebauer is our peer counselor. She's a lay person. The idea is to not have a professional in that role, and she supports women in challenges or bumps in the road in breastfeeding that they might encounter. And then Child and Teen Checkup has also been under that umbrella since 1998. It's funded through the Department of Human Services. It's specifically identified for families who are on medical assistance or on Minnesota Care Plan insurance, with specific components of what you addressed at a well child check. And other clinics oftentimes just do a child and teen checkup for only those on a medical assistance or a Minnesota Care Plan, but the clinic has decided that every child who walks in the clinic is going to, that those same components that are going to be used. It's a very thorough, everything from assessing mental health to looking at growth and development at every well child check. So we're pleased to be a part of that effort also. You guys have been generous in allowing us to have more of the funding of that, so we've been able to do more outreach in the sense that we go to, when grandpas, specifically to Grand Portage, when they have their health fair, through WIC, we try to do some outreach to make sure families participate and get their well child checks. And again, it's from birth to 21. And we send out regular reminder letters when the child is due for their checkup. So then we have the SHIP program, and Andrea Orest has joined us very recently, so I'm not going to make her talk too much about your Yeah, take it away. No, she really just did literally start in the end of November. The end of November, thank you. And she's just really jumped in with both feet, and we're pleased to have her a part of this. So between Hartley and I, we're going to tell you about the SHIP program.
This was a quote that I heard at one of the SHIP conferences a couple of years ago that obviously stuck with me if I remembered it long enough to bring it here to you today. That before we even think about making healthy choices, easy choices, we have to make sure that they're possible. And that's the foundation of SHIP for me. So, like I said, Andrea is our new coordinator. SHIP has what they call strategies. And so one of the strategies that we work in is active living, where all SHIP everywhere is required to work in the schools. Then past that, they don't tell you how to work what you're going to do. They just say, you gotta work in the schools. You work it out as a community and decide what's going to work best. And that holds true for the other strategies too. We don't get pronouncements from on high. This is community driven, and I like that because we get to decide what's going to work. And if it doesn't work, we can decide to stop that and try something else. Food access has been part of our work, and then workplace wellness. So for the community active living, safe routes to school. I know you've seen that. We've got a winter walk to school morning on February 6th coming up. That's part of that. Bike Ed has been happening for a number of years now. It'll be happening in the 3rd grade in the spring of this year. Oh, 4th grade. The bike safety rodeo last year we had 21 volunteers, excuse me, 40 children and 25 parents participate. And then we've done some partnerships with the city of Grand Marais. We did the crosswalk enforcement event that was quite illuminating. I was part of that, and it was interesting to watch drivers just blow by people that were standing in the crosswalk. The Highway 61 project, and then comprehensive planning through a health lens. Part of the work that we do with the schools is where we sit on the school wellness committee, and through that, the 2 biggies for this year were installation of hydration stations where kiddos can just fill up their water bottles, and then not the building, but changing a room. I don't know how many of you have been in the girls' locker room over by Pam Taylor's gymnasium, but there used to be there's a locker room and then kind of a closeted storage room in that. Well, it has been changed to a really welcoming lactation room. So there's a place for staff. We also work in the strategy of healthy food access. And so this is a picture from our local food market that happens on Thursdays in the summer. This year, we averaged about 8 vendors a week over the course of the summer, and between 50 to 75 shoppers each week, which we were really happy with because it was a significant increase from 2017. We had a workplace wellness collaborative this year. We started with these 4 employers. 2 were unable to finish, so we finished out the collaborative with WTIP and the Whole Foods Co-op. And we also had the previous year's cohort. Many of them decided to stay and participate as a networking or an alumni group for the next year to sort of keep the momentum going. And that was the county, the Grand Marais Family Dentistry, the Y, and then the clinic as an entity. So is there anything you wanted before we close out?
All good things are coming.
So that's all that I have on my end. Thank you. Big blue letters from all of us.
And I think that most of you are aware, if not everyone's aware, that Allison and I have been working closely along with Teresa Borak on transition and family home program, family home visiting program, which will actually complement everything Teresa spoke to around families and WIC. So we're looking forward to growing that, and, making it, as with your support, totally universal to our people throughout the county. I also want to mention too that many of the programs that we've spoken to complement, almost actually parallel and complement and work together the programs in Grand Portage. If there are certain funds that are allocated directly to Grand Portage, that like the SHIP funds, they go right parallel with the funds that we've been able to secure also. And if they do not have funding that is directly connected to Grand Portage, then what we do is we run the programs with the staff up at Grand Portage Health Services, and we run it through the clinic up there and complement what's already being done. So we try to make sure that everything we've spoken to happens in the Grand Portage area, Cook area, Western. We try to go to all the areas that we are identifying as our service area.
Are there any questions for the panel this morning? Sherry?
You do so much excellent work. The scope is really amazing. It reaches out to so many people that, thank you. I'm thinking about the Family Connects program, which we had talked about and heard a lot about through PHHS, and my understanding is it's somehow transitioned over to Sawtooth Mountain Clinic in some way, but I'm curious to hear a little more about how that works.
We have, as part of the process of working with Allison and taking over the family home visiting, we have explored 2 different evidence-based home visiting programs. One is Family Connect, and the other is Healthy Families America. The Community Health Board in Duluth, they're through Carlton, Lake, St. Louis counties, their public health department has added Healthy Families America to their home visiting. And their Minnesota Department of Health opened up some more funding to expand, increasing the amount of hours for home visiting in those counties, and also to invite Cook County to participate. So we decided we were going to try to jump on board with them. We should hear by the end of January whether that funding is given to us. And so the long-term picture is to get trained in both Family Connect and Healthy Families America, because Healthy Families America has a high-risk focus. And we feel like that is an area that would really benefit the training aspects for our staff to deal with and support high-risk families. And Family Connect is a universal across the board. Everybody gets a visit, which we're planning on using that model. And it's a limited number of visits, maybe 3. But if you have a high-risk family, then there would be no place for us to refer them to support and help them continue to make changes. So that's why we are going to try to get on board, if the funding comes through, to also train to do the Healthy Families America, which would be the high risk. So we would be able to extend that connection and that support, and hopefully make some changes and encourage that family to make some behavior changes that would change their
Good.
So that's kind of the big picture of what we're hoping to accomplish. Did that help and answer your question?
Yeah, it back when we were first hearing about Family Connects, it sounded like a very impressive program and evidence-based kind of a thing. And I know we sent people for training back then, and I'm hopeful that the investment that had been made is still going to carry through in some way.
We are in the process of connecting with the people at Family Connect to figure out how we can move forward with training our staff. And we do have someone hired to take over the family home visiting. She will start at the beginning of February. So it's gonna happen. It's just
good.
Take some time.
Good. Yeah, that's good to hear.
It is
Yep.
our ultimate goal to get, for sure, the Family Connect training. And then if the funding comes through for this Healthy Family America, great. We'll pursue that also. So.
I have one other question. Is SHIP funding solid now? Seemed like over the years the politics of SHIP funding was kind of an issue.
I think we feel, I'm not sure of how to answer.
I'm not either. We know through 2019 we're golden, but this is the year that past that will be decided. It runs on 5 years at a time. I've never figured it out entirely, to be honest. And that's all I know. And at this last summer's SHIP meeting in the cities, fingers crossed. We have the data to bring to the decision makers that's showing we're having an impact. What we're doing is working. If you look at obesity rates between Minnesota and the contiguous states, we're holding steady. Everyone else's rates are increasing. So we're doing something different, and I think that that something is SHIP. So hopefully they'll think the same.
Great, thank you. Ginny, you had your hand up.
No, I was just going to say thank you so much for what you do. I think we're all cut out to do certain things in life, and one of the things that you're doing is something that's really beneficial to the community, and appreciate it all, and welcome, Andrea. Next time we meet you, you'll be all ready to present, I'm sure. Thank you.
Myron?
Yeah, thank you. I would just like to commend everyone on collaboration. And I know that in these times, we have to try to do more with less, and this is one way of doing that. But I think it better serves the community that we're all in this together and work together. And thanks to our administration for making arrangements to get some more of this working when it's appropriate. Thanks.
All right, thank you all. We'll let you all get to work. You have busy schedules, and thank you.
I'm going to leave this for you in case I mentioned a couple of newsletters that I have, and if you want to be on the list, if you're not getting my newsletters directly to your inbox, you just fill this out. I'll leave it with Sarah, and then I'll make sure that you get the one in February hot off the press.
I'm on the list. They're very worthwhile.
They are. They're incredibly excellent speaking tools when one goes in front of various
Bodies.
groups for future funding. So thank you very much. Have a good day.
Thank you. All right, Allison.
Thank you, Rita. Thank you, Teresa. Thank you, Hartley and Andrea, for being here this morning and presenting on the great work that you're doing. Thank you, Grace. So I'm just going to give a few brief updates from staffing and the agency so I can save time for this year in review. I think in retrospect, I probably would have set that as the staff presentation. Maybe I'll do that next year. But this is a new for me in presenting this year in review. So welcome feedback from all of you and ideas for how to make it a more useful tool in the future. But just a few brief updates from the staff. We have under items for board action the hire of Kathy Ann Travis as our eligibility specialist. We had 5 excellent candidates for the eligibility specialist vacancy. This was the full-time, 40 hours a week to backfill Pat Strand's vacancy that was created when she transitioned over to full-time VSO. So really excited to be offering Kathy Ann's name for approval today and to have her join our staff. Her projected start date is February 4th. We'd likely begin with some on-site orientation and shadowing with this financial worker staff, and then would look at an early March or mid-March date for her first mandatory training down at DHS. That's the SNAP training, or Supplemental Nutrition Assistance Program. It'll likely be a year before she is really learning the long-term care programs, which will be her ultimate focus, but those are very complex programs, and the state actually mandates a certain number of months of experience before a worker can even begin to learn those programs. Also, under items for board action, we are asking you to accept with great regret the resignation of Jean Munson from our agency. She has accepted a new position in the probation office. So really thankful for Jean's service to the agency. She contributed a lot in her short time here, and we're happy that she's still going to be a part of the agency in a way in working with the people we serve who are in probation and also receiving human services. We are also in the process of developing a proposal for a contract position. And this is to address one of the many gaps that were created when HDC closed their Grand Marais office. What we are looking at is a community support worker position. And this would be, again, a temporary contract position that would be more of a kind of a mid-level paraprofessional type position to assist those who otherwise don't have a billing source or a diagnosis to receive MA billable services. So this is really that early intervention, connecting people with services, and we would be able to offset the cost of that with the funds that we receive from the state that previously were allocated to HDC. So I just wanted to let you know we did bring this to the Public Health and Human Services Advisory Committee for review and discussion and got some great feedback from that group. I just wanted to introduce the concept to you today and let you know that we'll be presenting a more formal proposal with more information at our next meeting. A few updates from the agency. We learned of the opportunity to bring ACEs training to Cook County. This will be hosted at the Sawtooth Mountain Clinic towards the end of the month, on the 23rd, actually. And that's from 1 to 4 in the lower level classroom of the Sawtooth Mountain Clinic. And you can find more information on that training on the clinic's website. ACEs, you received a brief introduction to that last month with Jade Waltman's presentation on children's mental health. ACEs, again, is the study that looked at adverse childhood experiences. Also, our community health assessment stakeholder group is meeting again at the end of the month, January 30th. We'll be reconvening to continue to work through the community health needs assessment planning work and the development of our community health improvement plan for the next 5 years. With that, I will see if I can seamlessly transition over to our presentation. Any questions on the agency or staff updates while I get this pulled up?
Jenny? My question would be on the contract position. You mentioned that would be funded through your department?
We have funds that we receive through the state to provide mental health services. Previously, those were allocated to HDC, primarily as the Community Mental Health Center. A number of those services, as I've shared with you in previous updates, are now being provided either through the clinic and their behavioral health specialists, those therapy services, and then Ascend is also in the community providing therapy services and some of the more paraprofessional type skills services to adults and children. So where we're seeing this gap most acutely is with people who aren't eligible for those reimbursements. So we could offset the cost of that with some of the funds that we're receiving from the Department of Human Services to support that position. But our model that we're envisioning is similar to Greg Barnier's position, where it's an independent contract position. It's not a Cook County staff, but very much integrated within our agency. Does that answer your question?
Thank you.
Okay.
While Allison's getting that rocking and rolling, we will do the items for board action. We'll start with A, resignation of Jean Munson and approval to post the vacancy. Can I get a motion for that item?
So moved.
Support.
All right, any discussion on that? All in favor?
Aye.
Any opposed? We'll move on to B, the hire of Kathy Ann Travis. Can I get a motion on that?
So moved.
Second.
And I'll just note for the record that Kathy Ann and I did work together in a previous job, and I was not any part of the interview application process. With that, all in favor?
Aye.
Aye. Any opposed? Great, thank you. Go ahead, Allison.
Great. So again, trying for the first time a little year in review of 2018 from our department. You all should have received an updated organizational chart that includes recent staff changes, some pending staff changes, a major change for 2019, just visually and looking at this, is the public health position that was previously shown represented as a vacancy within the org chart. We are no longer representing that in the org chart. We aren't currently actively looking to fill that vacancy, but as Rita mentioned, are in the process of reallocating those funds to the clinic in the form of a purchase of service contract for the Universal Family Home Visiting Program. So while we may have additional funds within the department to look at additional public health services in the future, at this point we aren't representing a vacancy in the org chart because previously that role was the family home visiting nurse. New staff welcomed in 2018. We welcomed 5 new employees over the course of the year. Starting with Sarah Schoonover as a case aide in February, and then most recently Grace was hired in November as a public health coordinator. All of these were replacement positions. There were no new positions added in 2018. So each of these individuals were filling a vacancy that was created by a retirement or resignation. 2 of these staff began with part-time distance orientation. So that was new for us in 2018. And we're grateful for the support of the board to allow us that flexibility with orientation and scheduling. As I said with Grace, it was really a nice way to get to know her and have her connect in with Joni as they didn't have a lot of time for crossover. As I mentioned at our last Public Health and Human Services Board meeting, we had 4 staff retire in 2018, which resulted in a combined almost 100 years of public service leaving our agency, and that's certainly felt by the staff when that amount of experience and knowledge goes out the door. So these are the individuals who, between them, had about 20 to 30 years of public service experience. Yafa and Beth came to our agency more recently and brought with them a number of years of experience, while Joni and Pat logged most of that experience with Cook County Public Health and Human Services. So very grateful for the service of these 4 individuals who left the agency. You'll notice we have 5 new staff welcomed, 4 staff who retired. The discrepancy there was the fact that we had a vacancy that wasn't filled. It was open over the new year. We had Linda Waterhouse temporarily in that adult services case management position before James was hired in May. So just a quick summary of activities by program area. These are social services intakes. An intake is a request for services. It could be a walk-in, a phone call, a referral. So these are the number of intakes received by Cook County PHHS from January through December 2018, and that were logged in our social services information system. Cook County PHHS has a designated intake social worker who that's her primary job responsibility is to be available for those phone calls and walk-ins during business hours. That's Heidi Akins. We also have a backup system in place where if Heidi is in a meeting or on leave or has a conflict, that we have someone who's designated as backup to be available if possible to anyone presenting in the office with questions or on the phone. An intake might lead to the agency providing information and referral. It could be a really short-term intervention, or sometimes an intake results in more long-term services and case management and a work group actually being open. And I'll transition next to our work groups. So these are the number of open work groups by program area. A work group is our internal lingo for a case, and that case could include one individual receiving services, or it could be a large family unit. So in comparing adult and home and community-based services to children's and family services, the various programs that someone could be receiving services with can vary greatly in terms of complexity, level of need. So it's comparing apples to oranges to compare these against each other, but again, just to show an overview of where we're providing services. So each of these work groups are open at least one day during the calendar year. Chemical dependency, you'll notice under children and family services. That could include the evaluations conducted by our chemical dependency evaluator, Greg Barnier, or it could be case management services provided by our agency social work staff in connecting individuals with treatment programs and ensuring that they have funding for treatment. Within the healthcare and financial assistance program areas, these are the case counts as of December 2018. So 116 cases or households enrolled in the SNAP program or Supplemental Nutrition Assistance. 575 households enrolled in medical assistance or Medicare savings programs. We've also broken that down by individual enrollment. So in terms of unique individuals receiving these services, 177 receiving SNAP as of December, and 1,050 receiving Minnesota Healthcare Program. So that's medical assistance and Medicare savings programs. We've broken this down further by the system that individuals are enrolled in. If you'll remember, we have two different systems in which people are enrolled in medical assistance, one being the METS, or Minnesota Eligibility Technology System, also known as MNsure. So that's typically families, single adults. And then we also have the MAXIS system. I don't think I even know, or I've forgotten what that stands for, but that's the legacy system. That's that green screen program that we've had for many, many years in the state of Minnesota. And individuals enrolled in that system are typically elderly or individuals with disabilities. So again, just a snapshot of applications received within the financial assistance programs area. There were 42 applications processed for expedited food support. Expedited is a criteria which allows our agency to approve benefits right away, so within 24 hours for someone whose income and asset availability are under the designated threshold. There were 2 families assisted in 2018 through emergency assistance crisis funds, and 1 single adult assisted in a housing or energy emergency. There were 2 county paid burials approved. So in addition to the staffing changes and the number of clients we saw in 2018, there were a lot of other items of note that happened over the year, including starting the year with some strategic planning activities within our department, and specifically in the area of public health, as we looked at determining how to fill that second public health position. Throughout the year, we've been working with the stakeholder group in planning for the community health needs assessment. We received funds from the state of Minnesota to create a position to provide supported employment services to support individuals with disabilities, and we did that in partnership with HDC and the school. We had a number of emergency preparedness exercises, and twice over the course of the year actually opened up an emergency shelter in response to power outages and wind events. The Public Health Community Fund management was moved to public health, and that was a significant change for our agency, and involved a lot of work with our Public Health and Human Services Advisory Committee as well. We established procedures in the area of estate recovery, which was an area where we hadn't been actively pursuing those recoveries for many years, so bringing on a fiscal officer allowed us to do that. As Rita mentioned, we're in the process of transitioning the Universal Family Home Visiting Program to the Sawtooth Mountain Clinic. The closure of HDC was a significant event for our agency towards the end of the year as well, and we're still, as I shared, working to address the gaps that created. And as always, we have multiple program audits and reviews throughout the year within each of the program areas, including outpatient treatment, in-home support, our financial assistance programs, and through the managed care plans that we contract with. Looking ahead at 2019, continuing to work with the Community Health Needs Assessment and CHIP development. We're working on the formation of a local advisory committee for adult and children's mental health. We're looking at revising our ordinance for tobacco, including e-cigarettes, and we're working to develop increased outreach and communication for our agency as a whole. So that's all I have for the year in review. I'll just quickly wrap up. I shared in your packets an updated legislative summary from the Minnesota Association of County Social Services Administrators, and just wanted to bring a few things to your attention in that summary document of legislative priorities. You'll notice a number of the priority issues focus on addressing gaps in the continuum of care for substance use disorders and children's mental health, some of which are addressing cost shifts and performance withholds to counties, which have increased the amount that counties are having to levy for and spend to support these programs. MAXA is aligned with AMC on many of these issues, you'll notice, including the Healthcare Access Fund. That is the sunsetting of the provider tax, is potentially defunding this Healthcare Access Fund, and that could impact medical assistance, Minnesota Care, and also the SHIP program, which the clinic staff presented on this morning. That would threaten the SHIP funding as well. So I welcome any questions that you have about the legislative priorities I shared with you or the presentation on the year in review.
Any questions or comments for Allison? Ginny?
Thank you. That was a lot of information, the statistics. Do you have a hard copy on that?
I do, yes.
Okay.
I'll be
May I
happy to
get one?
share a hard copy, and we can link
Thank
to
you.
that within the minutes as well.
Yeah. Because I'm asked questions when I'm out in the community, and if I have something that I can kind of look at or tell them to go online with it. It's online too?
Yeah, we could get that posted on our website as well.
Great.
Yeah.
Now, I guess I'm from the old school, but when folks have a person in charge of public health, they're called the public health nurse. Have you changed the name to coordination?
Yes, so Joni's title was actually public health coordinator as well, and the coordinator was because she was responsible for managing grants and contracts and such. So that's the same title that Grace has. She just doesn't have that public health nursing background.
So we don't have a public health nurse?
We do not.
have a coordinator?
We have a coordinator, yes. And then we are working with the clinic on the family home visiting, and we've also started to work with the hospital on some of the infectious disease requirements related to the Local Public Health Act and responsibilities of counties. So the clinic will be working, for example, with our first responders and in the jail for some of the infectious disease requirements.
Okay, thank you.
Jerry?
Well, just a comment that this ending of the healthcare provider tax at the end of this year is a big thing in terms of loss of funding for some important programs, and that will lead to more costs at the county level, as I understand it. So I think if, as an advocacy issue to our legislators, you know, I don't know how likely it is that they would reverse that, but some addressing of the gap that's going to be created with the loss of that funding. I just want to highlight that.
We will be attending the legislative session in February, and that will be one of our top priorities. There is money to get it through this year, but that doesn't mean we backslide, that we encourage them to continue it.
Yeah, yeah.
That they understand I think they do, they understand the impact of the county, so we'll keep reminding
Good.
them.
Anything else?
I just thought of one more thing that I wanted to mention related to potential impacts of the partial government shutdown.
My next question. That's very good that you read that.
So we are receiving information from the Department of Human Services with guidance on communicating to SNAP enrollees what any potential impact would be should the shutdown continue. To date, we've learned that funding is guaranteed through February, and March at this point is unknown. And this could impact SNAP, Women's, Infants, and Children, the WIC program, as well as food distribution programs through the tribe as well. Those are all federally funded. So specific to SNAP, we've received guidance as an agency on workarounds that are required to ensure that individuals receive benefits for February, which involves our staff, our financial workers, processing all reviews and recertifications for February early. So today is actually their deadline for processing that. So they're very busy upstairs working through those cases. As we learn more, we're working to share that out through our channels and welcome any questions that people have. I know this can be very stressful, the uncertainty of not knowing if the benefits will continue. So we just want to encourage people to call our agency if they have any questions about their benefits. Continue to fill out applications and report forms. I would discourage anyone from assuming that benefits are ending, so I shouldn't fill out my review forms. Absolutely continue to fill out your report forms and review forms, and contact our intake worker if you have any questions about benefits. 218-387-3620, and ask to speak with an intake financial worker. We also have our intake email account set up, which is IM, as in income maintenance, at co.cook.mn.us.
And Ruby's Pantry has also made some offers available to the community, just so that people are aware when that comes up. It's usually $20 a share, and they have some ability to waive that fee for individuals who need it. And that also includes federal workers who are not receiving pay. So, all right. With that, we will move into committee reports. David, being the new guy here, just to let you know, the reports are from previous attendance, and you were not at previous attendance. So although your name will be listed, we understand you might not have an update. So the first one is Arrowhead Economic Opportunity. They haven't met this year yet?
No.
No, so no updates. Arrowhead Health Alliance Joint Powers.
Nope.
And Arrowhead Regional Corrections.
We meet Friday.
Friday. And Arrowhead Regional Development Commissioner, Julie?
Yes, thank you. I'll give a report on that, and then I will have a comment about something else. So the ARDC also has a segment of it that's on the aging population, and they get federal and older American Act funds to come into different counties. So I will report that they had awards over $1.8 million, and AEOA in Cook County received funding, and Care Partners, Legal Aid Services, and Arrowhead Area Agency on Aging. So we were all recipients of part of that money, which they distribute out to part of the 11 counties that we're a part of. So that's great. Now, what I'd like to do is, along with ARDC, because this isn't their top priority, so this report is like at the beginning of the year. If there are things that I need to report during the year, I will, but I'd like to /add NACO, because I participate in a monthly phone visit from in Washington, D.C., and there's times that I think would be important to mention those. So, Madam Chair and Allison, if you think that would be important, to add that to my reports.
Allison, could we add J to be, or another line item for the good of the order? And just in general, if anyone has an update, and then that would be the place that Commissioner Storley could add NACO, and then if anyone else has anything to add that doesn't fit into their committee report.
Yep.
I think we did that way back when, for the good of the
Good
order.
idea.
The good of the order. And that would be
Yeah.
any committees that have items related to public health and human services
Yep.
that aren't
Right.
otherwise listed here.
Mhm.
So the update from Ruby's Pantry and stuff like that, if any of us have that, we can throw that in there.
Mhm.
There we
Okay.
go. We'll have a catch-all.
Thank you.
All right, Community Health Board. Dave.
Nope.
And Public Health and Human Service Advisory Committee, Carla and Jerry.
Okay, well, we met this month, and Rita spent a lot of time talking about about the clinic, which you heard, and about the fact that fortunately, she has secured a lot of the funding for the clinic in advance of this, and expects to have her $1.65 million grant in, I think, this week or last week. I think an interesting thing, too, was they're really gearing up to focus on the drug epidemic. And it turns out that Dr. Hansen was hired under a grant they received that would help with this, and she had prior training in it. And Dr. Yeah, I know.
Parchman?
Yes. He got the training already, and they are up and running and able to do this, and it'll be interesting to see how they develop it, because that's all you hear on the news, I think, is about how serious this is. And I think that'll be good. The other thing, this has nothing to do with that, but I heard on the news, and I just couldn't believe that e-cigarettes, there are enough teenagers addicted to it, because some of the tobacco ones have the equivalent of something like 10 packs in one, little vaping thing. And they have gone into rehab, teenagers, for this. And so I think that's an interesting to note for future work on that. And I think that ends my section of it. What happened?
Well, as part of your packet, I believe you got this year in review report from the advisory committee. And I'd just like to highlight a couple of things on that, if I could. The first page beyond the title page is a month by month, or I should say meeting by meeting, since we meet every other month, of some of the key things that we talked about and worked on in the committee. And you can, I encourage you to read through that and review the work of how the committee has spent its time. The next page is talking about the goals for 2019. And these are the most significant things that are on our plate, so to speak, for the coming year. Not that we won't be looking at other issues along the way, but we want to see that the local advisory council / subcommittee for adult and children's mental health gets established. That's a legally mandated thing that we have to do, and we've begun talking about how to do that. And we're actually going to have a meeting in our off month of a smaller committee meeting of some of us to structure that, put our ideas together, and bring a proposal to the advisory committee in March, and actually establish that advisory council. I think it's going to be as a subcommittee of the advisory committee, so the reporting will go. My best guess is now that the reporting would go through to the advisory committee and then from us to you, and that's an important thing, because we're going to try to draw other people from the community in who would have a voice or have feedback about mental health services for adults and children, and how we can improve and better deliver those. And that's a big topic this year in particular, because of the loss of HDC for most of their services, and transitioning to, what are we going to do to replace that? This proposed CSP worker, case manager that Allison was talking about earlier is a big step toward replacing some of the things that HDC was doing for people with serious and persistent mental illness, some of that day-to-day life skills training that is important to keep those folks at a higher level of functioning. And so to take some of that HDC money and bring it over to this contract position represents a very tangible step toward that. But that topic as a whole is very much on our agenda in the advisory committee. What are we going to do with mental health services, and how are we going to try to advise and support the transition to other alternatives? Looking at the tobacco ordinance and including e-cigarettes is a big one. We kind of got a start on it a while back with some presentations from the American Lung Association, and we need to get back to that and really look at how our county tobacco ordinance can be updated to include the whole issue of vaping and e-cigarettes and smokeless tobacco, and how that might come under a revised tobacco ordinance. So that's a big issue on our plate. In general, our advisory committee is all about collaboration between community organizations and service providers. We're not just looking at PHHS, but how PHHS interacts with other providers and other agencies, so we have a better coordinated picture for human services in the county. And then, of course, the Community Health Improvement Plan, which has been underway for several sessions, and as Allison said, we're going to have the next one at the end of this month and eventually come up with that plan to provide guidance for the larger community. And I'll just say, speaking from the North Shore Healthcare Association standpoint, we're very interested in that plan and how we can align with it and take guidance from the work that's been done to create that plan. So just from our foundation alone, that's an important thing that we're keeping an eye on. So that's the report of the last year and a little thought about where we're heading. And we've got as before, we've got a really good group, people who are motivated to be on our advisory committee. We have this roundtable every meeting, and it's really interesting and enjoyable to watch all the things that people bring up and how it all works together to give us a better perspective on human services. So that's
Thank you very much. Thanks for that visual for us. Healthcare Planning Committee, Ginny.
Thank you. So I guess the news from Kimber is very encouraging for folks who need chemotherapy. There will be some offered here at the hospital. They need to work with their doctor in the beginning, so they do not have any first infusions, but they will be able to do some of their therapy here, which I think for folks who have to travel to Duluth is going to be tremendous for them to stay here. Kimber also reported that they now have a new hospital director of nursing, which is great for them to have that established. Grace came and introduced herself. Of course, Allison is there to bring an update too. Jody from the Violence Prevention Center indicated or reported that they're going to be working in the school with 6th grade boys groups and 7th grade girls groups, so they're going to be active with that. And let's see. Well, Rita gave a little report this morning, so that takes care of my topics for that meeting.
Thank you. North Shore Collaborative, Dave?
No, thank you.
Emergency Preparedness, Ginny and Myron.
Well, we haven't met yet, and I don't know if we have one scheduled for this month yet.
I don't think so, but we'll wait to hear.
All right. With that, can I get a motion to adjourn?
So moved.
All right, for your perspective, Myron's voice was the loudest, so we'll take him.
Sorry about that.
That's all right. Everybody waited.
Point of order, do we need a motion to adjourn?
We just have always done it.
Okay. One of those things.
Which is the answer that I hate when anyone says it to me, but we are closing this meeting, so we are adjourning it.
Okay.
All in favor?
Aye.
We are adjourned. Thank you. Jimmy, what time is the committee of the whole meeting? 10:30?
I'm sorry. Allison was doing this.
Maybe two.
Wow.
It's okay.
Christmas, Heidi.
All right, great, great. Thank you.